Yes, I'd like to call the meeting of the HHS Public Health Communications Subcommittee meeting to order. Roll call, please.
I'll note that all three members are present for the roll call.
Perfect. The next item of business is approval of minutes from September 21st, 2020. Do I have a motion to approve, please?
I moved. Oh,
That's
okay.
Are there any additions or corrections to the meeting minutes? Seeing none, they'll stand approved as printed. One business item this evening is the digital town hall and the communicable disease ordinance, and I'm going to hand it off to Bob, who is going to introduce that for us, please.
Thank you, Chair Lee. Ken, I might need a little help sharing the screen. I don't have that enabled. But let me start with saying hello and welcome to the Communicable Disease Ordinance Town Hall. My name is Bob Rarrett. I'm the Director of Health and Human Services for St. Croix County. Let me see if I can share my screen. Yep, just a second. There we go. And joining me this evening are four expert panelists that I'd like to take just a minute to briefly introduce. And I'll start with Kelly. Kelly Engen is the St. Croix County Health Officer and has been in her position since October 2018. Kelly graduated from the University of Minnesota with a Master of Public Health degree focused on public health administration and health policy. In 2007, Kelly graduated from Viterbo University with a Bachelor of Science in Nursing. She has worked in a variety of public health settings, including tribal health and local public health departments. Next, I'd like to introduce Elly Clausen. Elly has a Bachelor of Science in Biomedical Sciences from the University of Wisconsin-La Crosse. She attended Johns Hopkins Bloomberg School of Public Health in Baltimore, Maryland, where she earned a Master of Science in Public Health in Epidemiologic Methods and Biostatistics. Elly has over 9 years of experience in public health and has been published in various scientific journals. She has been the project manager for multiple large-scale community-based research trials in Nepal, Kenya, India, and Peru, and worked locally with many public health nonprofits and the University of Minnesota. Next, we have Scott Cox. Scott is an attorney who serves as Corporation Counsel for St. Croix County. And finally, Dr. McGinnis. Dr. Paul McGinnis is board certified in family medicine and licensed in both Wisconsin and Minnesota. Dr. McGinnis moved to Hudson and began his practice as a family medicine specialist following the completion of his residency at St. Paul Ramsey Medical Center in 1987. He's also been an owner and active leader in Hudson Physicians for many years. For more than a year now, Dr. McGinnis has served as a member of the St. Croix County Health and Human Services Board and remains committed to improving the health of the citizens of St. Croix County. If I could talk just a little bit about the town hall tonight. First, let me say that there will be no vote on the ordinance tonight. This is a forum to answer your questions. We will have 2 hours for attendees to ask a question about the proposed ordinance. All attendees will be muted until it is their turn to speak. Each attendee will be given up to 2 minutes to speak. After the attendee has finished speaking, they will be muted. If a question was asked, the panelists will be given time to answer the question. If only a comment was provided, we will then move on to the next attendee. Attendees are limited to asking one question. Please do not ask more than one question or multi-part questions to allow time for other attendees to ask questions. Panelists will not answer the same question more than once. All answers will be available in the recording of this video and will be made available on the St. Croix County website. If a previous attendee asks the question you wanted to ask, you can use your time to ask a different question, provide comment, or give your time to someone else. We will answer as many of your questions as we can during this town hall, and we will collect all questions not answered here today. For in-person questions and comments, we will alternate between online, phone, and in-person attendees. For those in person, please fill out your comment card with your question or comment. In-person attendees will be called on the order they are sitting, starting from the front to the back in the county boardroom, then moving to the overflow rooms. After you have spoken, or if you did not have a chance to speak, leave your card in the comment card drop box. For questions or comments by phone, for those participating by phone, you will be muted until it is your turn to speak. When it is your time to speak, you will hear a prompt asking you to unmute. To unmute, press *6. Questions and comments online. For those participating online, please type your questions or comment in the Q&A panel. When it is your turn to speak, you will be prompted to unmute. Whether you are for, opposed, or just have questions about the ordinance, we understand that this is a topic that is personal to many of us. We ask that everyone be respectful and avoid derogatory or profane language. Attendees using derogatory or profane language will be muted, and we will then move to the next attendee. At this point, I'll turn it back over to the boardroom.
All right, thank you. We'll start calling participants. And the first one that I have is an attendee. And so we're going to allow Jim Endel online to ask his question.
Can you hear me?
We can.
Thank you. Chairman Leaf, committee members, and panelists, thank you for the opportunity to speak today. I have a comment and one question to go through. First of all, let me just say I oppose this ordinance. I think it's going to give unprecedented and unconstitutional power to an unelected official. You will be making a tyrant. If enacted, you'll be responsible for inflicting evil on the people of St. Croix County. This includes what we've seen in California. I would expect that this person would be able to shut down businesses, crush their businesses, and shut down churches as well. I think it's horrible what they've done in California. All what I've seen about this particular ordinance gets to that same issue. I would ask you to kill this ordinance or any thought of it tonight. My question is simply, how many people are online and how many people are in the public gathering place? Thank you.
I can maybe best answer that question. We have 82 attendees online and in person, probably a similar amount, maybe closer to 100.
Thank you.
Adam, you are up for in person in the boardroom.
Whenever you're ready. All right, thank you. My name is Michael Sakura. I am also vehemently opposed to this ordinance and all like them. I find this ordinance vague, a violation of our constitutional rights, contradictory in a couple elements, and I'd like to go through those quickly. For example, in the section 4105A1, the St. Croix County Health Officer, upon the appearance of a disease, a communicable disease, can make an order. Under section 4, the St. Croix County Health Officer may do what is reasonable. What is reasonable? No definition to be given to reasonable. And if the St. Croix County Health Officer suspects somebody is doing something wrong, they can go after that individual, which we might find is also violates due process and could limit their freedom of movement. So 2 violations of our rights in that place. In contradiction on those vague elements, the St. Croix County Health Officer, upon the appearance, of a communicable disease. The definition of communicable disease laid out in the very top of this says a communicable disease is set forth by the Wisconsin Department of Health and Human Services by rule. Which is it? It's not described in detail. That is my question, which I'll close off at the very end of this presentation. My last point here is this thing reeks of subterfuge by this county board. And the purpose, and I oppose this order, the DHS doesn't take into account competing elements of our lives. They're unilaterally going after one objective, which is to improve health, but not in consideration of all the other elements of human life. So I'm opposed to that. I also propose that the antithesis of this order is put forward at the conclusion of this presentation, and that the limits on the DHS are set forth, and that they cannot put forward any limitation on human rights going forward. So in conclusion, that's all I have today. Thank you.
Was there any panelist response on that one? So next up, I'm going to.
Ken, he did ask a question. I believe it was more defining the vagueness of the ordinance, as you put it.
So 4105A1 defines the Sacred County Health Officer.
I think Scott
Give me one
should
second.
speak to that.
If you could just frame it up.
Yeah, so the question is, what is the definition of a communicable disease? And here's my point. There's a contradiction under definitions A. The communicable disease means any disease that the Wisconsin Department of Health and Human Services determines, comma, by rule, comma, to be communicable in fact. Then, under 4105A1, the St. Clair County Health Officer, upon the appearance of any communicable disease outbreak, epidemic, or pandemic in St. Clair County, et cetera, which is it? One or the other? Is it set forth by the state or the county officer? Because it doesn't lay it out clearly enough.
Well, this is Kelly Ingen, and I'd like to attempt to answer some of these questions. I know there are a couple questions in here, so I'll do my best to address them. So in the state of Wisconsin, there is an administrative rule called DHS 140, and that really looks at what health departments do on administrative rules related to communicable disease. That is set out in statute 252, and they don't define communicable diseases in state statute 252 as well as they explicitly do them in the, or define them, I'm sorry, in the Department of, in the other order. Sorry, I'm Scott, you're gonna have to help me with my terms here. The 140 really looks at putting communicable diseases in different categories, and they're really shaped in different categories, and that is really set by the Department of Health Services at the state level, and categories have a certain urgency depending on the communicability and the infectiousness of the disease. That really determines which are highest priority to address across the whole state for every local health department. And COVID has been named as the most urgent, I guess, category 1 disease according to the DHS 140 rules. That was added shortly after we discovered COVID-19. The Department of Health Services decided that that needed to be something that we take immediate action on. There are 3 categories of diseases. I don't have them in front of me, but we can certainly get those published so everyone can view them.
And if I may, I don't think there's a contradiction in the ordinance. The ordinance definition controls. So under the section, so when the health officer discovers an appearance of what is a communicable disease, that's triggered by what the state determines to be a communicable disease. She or he doesn't have that independent authority to make up what a communicable disease is. It's defined by state law. It's defined by state administrative code.
And I would just like to add, I think the legal language is a little bit confusing. When we say the appearance or suspect. Those two words are not very clear for the general public. And what they're talking about, suspect, to me, is a lab confirmed report or a suspect case in our Wisconsin electronic disease surveillance system. I certainly don't have the time to run about the county and look with my own eyes for people who may or may not have communicable diseases. So these are lab results.
Language that was cited as contradictory is taken right out of the Wisconsin statutes and incorporated into our ordinance. Thank you.
All right, thank you for those responses, and thank you, Marty, for patiently waiting. It's your turn on the floor right now.
Thank you. Yes, I'm Martin Gore, and I've got a question. I've actually got a concern, and I also agree that this should not be enacted for the following question. You know, in the proposed ordinance 41.06, section B, item number 2, it specifically says to enter any building with special inspection warrant under Wisconsin statute to inspect, and my concern is remove therefrom any person affected by the communicable disease. Yet Wisconsin ordinance 252.06, section 3, part of that states the diagnostic report of a physician. This person is not necessarily going to be a physician, but in this section, it says the diagnostic report of a physician, the notification or confirmatory report of a parent or caretaker of the patient, the belief in existence of the communicable disease shall require the local health official immediately to quarantine, isolate, or require restrictions. Where does that state that the person can be removed from their home? You're basically stating in your ordinance that the person can be removed from the home, and that could be a child. I find, as a parent, I find that is an exception with this COVID-19. We are told to lock down in our homes. I totally disagree that this person would have unlimited powers with no definitions of what the communicable disease should be. When the ordinance itself identifies communicable diseases, then goes and lists HIV, as I think Kelly indicated, the COVID-19. There's no parameters. You're going to put parameters out there. It should be CDC guidelines or federal government controlled and identified what the communicable disease is. I yield back my time. Thank you.
Any panel response?
So the process to.
Oh, go ahead, Ken, or Scott, sorry.
Go ahead, Kelly.
I guess I really would like to clear up. I think there is misinformation and information out there that is leading our public to believe that the health department thinks we need to have the authority or the control to rip children out of their homes. That I can assure you that is not the case. That is not the intent.
If I may interrupt, it's in the proposed ordinance.
Go ahead, Kelly.
Where was I? The intent and the spirit of our local ordinance isn't to give the health officer any power that we don't already have under state statute. That has been said a number of times. It simply provides a civil forfeiture mechanism. I'm probably not the best one to articulate that, and I will yield to Mr. Cox to really clarify that for people. But the spirit of this ordinance is not to take away anyone's civil liberties. It is merely to protect the public's health in relation to this unknown pathogen that we've been facing for the last 7 months.
The authority to petition and remove someone from a house is already law and contained in Administrative Code 14506. it's not something that's new, that's created by this ordinance. The authority already exists, but it requires court approval. That wouldn't happen without court approval.
All right, thank you. Adam, you're up in the boardroom.
You're up.
Hi, I'm Angelica Young. As a society, we are always balancing liberty with risk. There's an inherent risk to life. There's a risk to drinking alcohol, and we hope that people will be responsible and won't destroy others' lives while abusing it. But that happens. The science on alcohol is clear. We'd be better off with forcefully prohibiting the consumption of alcohol. Why do we allow people to drink alcohol or smoke cigarettes or eat unhealthy food? Because we want liberty. Yeah. If these rights are already afforded to you in the state constitution, why are you writing an additional ordinance? The residents of St. Croix County are stating loudly and clearly, we don't want to give up one more ounce of liberty, and we don't support this ordinance. If you don't need it, don't write it, don't pass it. In the comments on the county's state ordinance survey, I read through all 540 something comments. Over 400 respondents clearly communicated they do not support this ordinance. By comparison, 7 times fewer respondents communicated direct support for the ordinance. That's a 7-to-1 ratio. In other words, for every one person that wants this ordinance passed, 7 people do not. You need to listen to your residents in St. Croix County. I also have a petition here that at this point has 360 signatures of people that were not able to come tonight and counting, 10 in the last 20 minutes. They all do not, they oppose the ordinance and any same or similar ordinance. Thank you.
All right, next up will be Carrie Reese.
Hi, I am the first one here to speak in support of the ordinance. I would like this committee and the county to do everything it can to protect us during this period of time as we learn more every day about COVID-19. I have 85-year-old parents and I want to see them on a more frequent basis than I already do. I'm caring for an infant grandson, and when I go around the county, I am astonished at the casualness that I'm seeing people act. It is a rare time and we all have COVID fatigue, but I just would encourage this committee to follow the data and follow the science and do what you need to do to protect us all. Public safety should be the number one thing during this period of time. My only question for you, it has to do with the spike that we recently saw. Last weekend, our president was diagnosed or came out and said he had COVID-19. And I opened up the county dashboard and saw that we had 40 new cases. So I'm wondering if we have anything in particular that we can point to that says why we had a spike.
I think I'll start that. This is Kelly Ingen, and then I'll let Elly, our epidemiologist, fill in the specific gaps. We have seen over the past 2 to 3 weeks an absolute increase in total cases per day. Our average is 23.4 per 100 population of new daily cases. Some of this can be attributed to, we know it is spreading in our community. I think I'll yield to Elly to let her really talk about maybe some more of the specifics. I'm not doing case investigation myself. Well, I shouldn't say that. The day we did have 40 cases, I did do case investigations myself. And there weren't patterns that I saw, but I know our staff have talked about different social events and different gatherings where spread of COVID is happening. Thanks, Kelly, and thanks, Carrie, for your question. Again, my name is Elly, and I'm the epidemiologist here with St. Croix County. So 40 is a lot of cases, and 40 kind of is an outlier in that it is an extreme amount of cases, but it does fit in the general trend of what is happening in our county in terms of not only case positivity, which is those of all those who are tested, those that come out positive. We have a very high number there, as well as just our general trend in the number of cases resulting positive. I'm going to quickly just bring up a graph for all of you here. So as we can see here, the blue bars you see across the bottom are new confirmed cases. And what this is an individual laboratory confirmed case. One individual counted on the left-hand side on the number of confirmed cases, and you can see that general trend is driving us upward, as well as Charlie mentioned our case incidence, which is a number, an average, so 7-day average of the new daily cases per 100,000 population. And you can see that lighter blue line there has dramatically spiked since the middle of last month. Thank you.
All right, thank you. Adam, you're up in the county boardroom.
You're up.
Good evening, Tim Holden from Baldwin, Wisconsin, and I'm totally against the unelected healthcare officer, and there are many reasons. It goes against the Fourth Amendment of our Constitution and the Bill of Rights that should supersede all of this. It's what my dad fought for in Nazi Germany, against this kind of socialist thinking, and almost died. And I'm representing my 3 Marines that all 3 saw combat in this war, and my oldest, a recon Marine, was wounded twice. And what they're doing here is despicable. It's totally despicable, and I would ask the board, are you socialists, or do you believe in our Constitution, or are you just puppets for Allison Page, and we know what she's been doing behind the scenes, and you know who I'm talking about. Are you socialists, or do you believe in our Constitution? Thank you.
All right, Christy Anderson online is up next.
Hey, Ken.
Yes, can you hear me?
Ken?
All right. Christy Anderson, River Falls, Wisconsin, and I strongly oppose this proposed ordinance as well. I think the wording in this proposed ordinance is not only vague, but is very dangerous. I think this ordinance can be simply summed up to state one person gets to make all the rules, and if you don't follow them, you will be penalized. This proposed ordinance has wording that states all measures necessary, which has not been defined. That concerns me as a parent of 3 children. The wording also states reasonable and necessary. We don't have definitions for what's reasonable and what's necessary, and that can be completely different for each person. Examples that the government have considered reasonable and necessary are mandatory masks, shutting down businesses. I haven't been able to attend church for months. And soon to be added, I fear, to this list is forced mandatory vaccines. And the language that really disturbs me the most, and I hope to God that it disturbs you too, the public health officer should have all powers necessary without limitations. No limits. I'm afraid our unchecked government is becoming more dangerous and more of a threat than the pandemic itself. This overreach of power that is continuing to be instituted over healthy, law-abiding individuals is so alarming. I'm a full-time healthcare worker. I'm a mother of 3 amazing children, and I think I represent the working middle class and parents that would say, I want to be informed, but I don't want to be forced. Let me choose for my family what is best. Let me make choices for their health and mine. Elected officials, you have an obligation to uphold the civil liberties and constitutional rights of your constituents. Do not sacrifice or exchange those rights for the temporary relief of fear. Thank you.
Thank you, Christy. Adam, I think, had maybe an unanswered question from the last one. I might have missed that.
Yeah, so it was about whether or not we believe in the Constitution, I believe, was the summary of the question.
And if they are socialists.
Okay.
I'd like to know that.
Did you get that? Board?
Very simple. They don't believe in the Constitution.
They might not hear me.
No, they haven't answered the question.
Do you believe in the Constitution or are you socialist? Simple.
So are you asking all of us or the panelists?
One at a time. You can go first, Kathy.
Oh, absolutely. I'm in favor of the Constitution. In fact, I have Revolutionary War ancestors, so you betcha I'm in favor of the Constitution.
I also am in favor of the Constitution. This is Kelly Ingen. My grandfather lied when he was 17 years old to get in the Army, and he was a part of the 131st Airborne, I believe. Yes, you bet I do.
Absolutely. My father served in World War II as well, and my brother was forced recon as well.
I believe in the Constitution. This is Elly Clausen. I have multiple family members and close friends who are active and former military.
I believe in the Constitution. However, sometimes constitutional rights have to be limited to protect people and keep people from dying.
All right, Adam, you're up with the next question in there.
So next we're moving to the individual down here.
Good evening. My name is Alexander Oswald. As a member of the military who served and continues to serve to protect the freedom and liberties of this country, his family, and community, I see this ordinance as a direct violation of those freedom and liberties that I voluntarily swore to protect. I'm done.
So next up, we have online Josh Mannion. Josh, go ahead.
All right. Thank you for giving me an opportunity to speak. I really appreciate it. My name is Josh Mannion, and I am on staff as a pastor at a church in Wilson. And I would like to speak in opposition to this ordinance as well. I pretty much agree with everybody that has spoken so far in opposition to this. I just have a lot of concerns. The power that this individual would be given, to be given all power necessary to basically carry out whatever action they see fit. And to me, it's just very concerning to give one person so much incredible power to basically make up rules and laws as they go along in every situation. But my concern is coming from the perspective of what happens to our religious freedoms, the religious rights that we have as a church, if a health official can come in and into a public building, as it's stated, and to even determine whether our buildings are kept sanitary. They could tell us that we couldn't have church simply because they deem the building as unsanitary. or it says that they may forbid public gatherings when deemed necessary. The wording is just so vague to me that's very concerning, that I think that our religious rights and our religious freedoms could be in extreme jeopardy if we were to allow this to go through. And so I guess I'm just asking, what happens to our constitutional rights with religious freedom if this one person decides that our services need to be shut down?
Thank you, Josh.
Thank you.
Analyst?
The ordinance is not, the purpose of the ordinance is not to deprive people of constitutional rights. The ordinance is concerning a communicable disease like COVID or some other disease that can wreak havoc, death, injury, both economic and personal. Constitutional rights, whether to liberty, speech, assembly, freedom of movement, religion, or autonomy, are held in our society on several conditions. The most basic and important of these conditions is that one's exercise of their rights does not endanger another person's right or the public welfare. This is exemplified in a Supreme Court decision, the seminal case involving public health, Jacobson versus Massachusetts, which ruled that the rights of not to be infected by a disease is paramount as opposed to an individual's right to do what they want. Constitutional rights are sacred, but there are some limitations. And those limitations have to be narrowly drawn such that those rights are not unlawfully infringed. We have a myriad of laws in this country that infringe upon constitutional rights, but they're drawn in such a nature so that they have the minimal impact for a compelling interest to protect people and to protect public welfare. And when and if that becomes necessary for the public health officer to issue an order under this ordinance, she will be advised by legal counsel, experts, so that such ordinance such order would be minimally invasive to protect everybody's rights, including the right to be healthy and safe.
Thank you, Corporation Counsel Cox. Adam, you're up in the county boardroom.
And back there. We're going through.
My name is Charlene Stoddard. I live in Roberts. I've been here standing by listening for the last couple listening sessions. First, I would like to thank you for giving us the time and hearing our voices, because I know the neighboring communities have not been as kind. A lot of what I had to say has already been said. What is reasonable and necessary? Who determines that? Please don't answer that when I'm done speaking. No person may interfere with the investigation under this ordinance of an unelected official. Who's appointing this unelected official? Who would be next in line if that person? Scott just said this is minimal. Why did the board choose the most restrictive version when they chose it? If it's so minimal, why is it necessary? Left my phone over there, but if you look up the data from CDC, 2,800,000 and some thousand people died in 2018. Less than that died in 2019. As of the end of September, 2 million, excuse me, my numbers are 2 million people, just over 2 million people passed away in the United States. That leaves us on track to have less deaths this year than the last 2 years. Why are we doing this? I just sacrificed 14 months of my life for my husband to serve overseas, and I know you all have family members that are deceased or have served. We still have soldiers that are missing that left this country to fight for these rights. Stop this ordinance. We will keep showing up and we will defy it if you pass it.
I don't know if there was a question on there that she had that needed to be answered. If not, I'll move on to the next one.
She said that was a statement.
Okay, go ahead then.
Who appoints the health officer?
She said that she does not want answers.
Oh. Well, can we just answer that? Because that's an easy one
Sure.
we can answer. Thank you.
The county board appoints the health officer. The county administrator with board approval appoints county health officer.
We have Sarah Yakub.
Hello. Can you hear me? Nods. Okay. My name is Sarah Yakub. I'm a resident of Hudson. I appreciate Chairman Leaf, panelists, everyone taking the time. I think it's important that we not lose sight that we have more that unites us than divides us. We all know what it means to care about this community, our kids, our health, our economy, and we have different perspectives about how to go at this, and that's okay, but seeing the humanity in each other, I think, is important. We keep hearing about unelected officials. We're a government of and by the people. We submit ourselves to unelected officials all the time as a function of public safety, our local law enforcement. Yes, we elect our sheriff, but we don't elect our Hudson police chief. He is appointed. And we seem to have no problem functioning with an orderly system of law and order where somebody who is unelected has similar powers. We are so blessed in this community to have very smart, accomplished attorneys like Scott Cox, to have really impressive epidemiologists like Elly Clausen. We have a tremendous team here. Let them do their work. These aren't power-hungry, lunatic tyrants. These are good people who are invested in this community. We cannot have a healthy economy unless and until we have healthy people. We tried to do this on the honor system to let people decide on their own, and it's just not working. I fully support this ordinance, and I'd ask people to take a step back and just give it a shot. At this point, what do we have to lose? This virus, it's a war. And if we don't do something, if we don't come together like every other war, we will lose. And I don't want any of us to be sick or to lose family members. And I'm sure that goes for most of us, if not all of us. Thank you.
Thank you, Sarah. Adam, you're up next in the county boardroom.
Did you have a comment? No. Okay. Sir?
Good evening. My name is Paul Horsley. I'm a Hudson resident. I'm opposed to proposed communicable disease ordinance. It is not necessary for St. Croix County to have the ordinance or any similar one. The state already has established provisions for illness disease reporting within Wisconsin. The list of required reporting contains 82 communicable diseases. All language has meaning, and the absence of definitions does as well. Many St. Croix County residents have expressed to me that they are alarmed at the language of the drafted ordinance. For example, there are 82 communicable diseases listed in the Wisconsin and outbreak. And an outbreak could be considered one person in a county, which could forbid public gatherings. There are no parameters regarding the isolation and quarantine regime of an individual who has been in contact with a person who has been confirmed to have the disease, a communicable disease, any disease. Nor is there any clarity about what in contact means. Additional alarm is raised how these previous in contact people will be removed from their homes, schools, or places of work. The ordinance is silent on the degree of force which will be used. Further, no specifics are provided about where these individuals will be detained or how much if any, communication they'll have with family members. As has been stated repeatedly by numerous residents of our county, this ordinance is far overreaching of our county board's authority and is unconstitutional. Therefore, if this drafted ordinance is moved forward, it will bring about costly lawsuits, which will burden the taxpayers, myself included, of the county. It's unfortunate that the board members are not here to enjoy this live presentation. The amount of people out front in the peaceful protest was amazing. And Mr. Cox's statement is exactly the evil that we're fighting against.
Yes.
Do you want the panel here or not?
Do you have a response? Go ahead.
I do. I think some of the alarmness of the ordinance being really vague related to 72 or 82 different communicable diseases, we really do have to remember that each specific communicable disease has different periods of infectiousness and different periods of latency and different times at which risk transmission is very likely, I guess you would say. I think Doc McGinnis can probably articulate this better than I can too. However, that is one of the main reasons why there aren't very, very specific parameters, because each communicable disease is very different.
And I think to Kelly's point that there are standards established through CDC or through the state around which there are protocols for how each disease is handled, and they are handled differently based on the things she identified with the disease. So tuberculosis behaves very differently than COVID, which behaves very different than, say, a enteric disease, a bowel disease. So there are standards out there. They are codified for each disease, but it's tough to include all of those in a single ordinance, and it changes.
Okay, thank you. Next up, we have online Rebecca. Go ahead, Rebecca.
Hi, I just have a comment. We tried to get masks and social distancing compliance voluntarily because we thought Wisconsinites would do the right thing to protect our neighbors, our friends, and our families. And while a lot of Wisconsinites rose to that occasion and did and are still wearing masks and practicing social distancing to protect other Americans, unfortunately, not enough people did. And now we find ourselves the third worst state in America with COVID cases and hospitalizations. In addition to this, we are now seeing businesses suffer due to reduced capacity limitations of 25%. If we don't do something now, not only will we risk another lockdown, loss of jobs, and possible permanent business closures, we risk unneeded suffering, unneeded deaths, and if you're for saving lives, saving jobs, saving businesses, we must pass this ordinance. We can only do this together. Can you hear? Okay, thank you.
Adam, you'll be up online in the boardroom next.
Okay.
My name is Lynn Betzel. I live at 706 159th Street in Roberts, Wisconsin here. I have the honor to represent 48 families of the Amish Baldwin Woodville community. 9 of those Amish gentlemen have come here personally, and they are available to speak to any board members who may be present or could drive in to speak with them. They are unanimously opposed to this ordinance or anything similar. Bishop Amos Miller has written the following letter. He resides in Baldwin, 2205 80th Avenue. This is in regards to our lords of the land, that we pray and ask you not to take our freedom from us. We, as a group of 48 families, are very much opposed to your new regulations and that concerns of having the health department more power and all the other items in your plan. We have had a few hundred years of freedom, and we want to be thankful for having it. Now, these new regulations wouldn't fit into our Constitution for having those rights taken away. Hoping you would reconsider your plans. We want to obey the laws of the land as long as they are constitutional and not against our beliefs. We hope something can be worked out for all our good. Let us ask God for guidance. The United States is based on freedom of religion. Thank you.
Next up online is Sarah Adkins. Sarah, go ahead.
There we go. Hello. Are you able to hear me?
We are. Thank you, Sarah.
I thank you for the opportunity to speak today. For the record, my name is Sarah Adkins. I'm a Hudson resident. I urge you to put the proposed communicable disease ordinance on the HHS board meeting agenda, and then to recommend the ordinance to the full county board. I see this as a necessary first step in getting full consideration from the county board to pass it. Prepare for the worst, but hope for the best. This is a quote from Benjamin Disraeli, a British statesman who was born over 200 years ago. It still stands as true as then. Hope alone will not prepare us for the possible arrival of a terrible crisis in St. Croix County. We have seen COVID get out of control elsewhere, and the realities of that are heartbreakingly terrible. St. Croix County has, for the most part, fared quite well, at least so far, compared to many other Wisconsin counties, but not so in the other side of our state. They are seeing a surge in hospital cases right now. Hospitals there are now, in fact, overwhelmed, and the fear is that they are reaching capacity and experiencing extreme staffing shortages. Today, the governor activated a field hospital in eastern Wisconsin, an alternate care facility at the Wisconsin State Fair Park, and that facility is going to begin accepting COVID cases next week. This is happening now. It isn't an uncertainty anymore. It's happening today. When the hospitals are overwhelmed, it doesn't matter if you have a heart attack or need emergency surgery. You need to get into the hospital. And if and when we overwhelm our hospitals, you will not be able to get the care you might need, even in a non-COVID related event. We have to prepare ourselves for the event that this will happen here and in the Twin Cities. And when it does happen here, do we want to rely on Madison to help us determine our best approach to our unique circumstances? Madison doesn't have a Minneapolis metro area in a different state right next door. The way I understand this ordinance is just a start to giving us local ability.
Thank you, Sarah.
Thank you.
Right. Dr. McGinnis, are you able to answer the capacity question on that part?
Yeah, I think that, Sarah did highlight the fact that there are significant issues in the eastern half of the state, the Fox Valley, the Green Bay area, in terms of hospital capacity and capability. Obviously, here in St. Croix County, we're not at that point at this time. We have seen a little uptick in residents hospitalized, although it's not a huge number. We've also seen another death that was recorded just today. So the challenge with an epidemic is that it can go from some cases to a lot of cases to really bad fairly quickly. And that's part of the problem, is that by the time you're reacting to a lot of cases, you're so far behind the eight ball, it makes it more difficult to catch up. And the measures that have to be used to catch up, to get ahead of this thing, are more difficult for the general population. So I think that the County Public Health Department, the Health and Human Services Board folks are very interested in trying to keep this thing down at a low level. I'd love to say we can eradicate it, but that's not the case. And how do we manage to do that? And at the end of the day, it really involves each of us taking that responsibility to stay apart, keep that distance out there, to wash the hands, And yeah, wear the mask. I don't like it, but it protects those that I may come in contact with or may approach or may pass in a store. It also means avoiding really large gatherings, more than 10 people indoors, especially where there's alcohol involved, because that decreases our judgment, and also where there's a lot of loud talking. And those are and just not the use of those distancing and those other guidelines. Those are the tools that we have. We don't have a vaccine yet. We don't have medications I can give to an outpatient if they get it. And that's the hard part. I wish it were different, but it's not. So long story short, a lot of what we're trying to do is to keep this under control so we don't end up overwhelming all of those other healthcare systems and have this just really take off in our county. And that's part of the alarm in the last 2-3 weeks. All of a sudden, these numbers changed. And it doesn't, and Elly or Kelly can correct me if I'm wrong, it doesn't appear to be coming out of the schools. I think they're doing a pretty good job, and they should be commended for that. And I think it's up to the community to support the businesses, the schools, in that effort, and to support our healthcare institutions. And as I often say, part of our job as individuals, as citizens, is to protect those vulnerable, especially our elderly, and the people for whom this infection is not a small deal.
All right, Adam, you are up with in person in the boardroom.
My name is Blair Gunderson. I'm from Baldwin, Wisconsin. My wife and I have had a jail ministry here in Hudson for 20 years. We've seen people set free from fear, anxiety, worry, depression, suicide, and I would like to say I'm not in favor of this ordinance, and I think it would put people in more fear and bondage. And no one person should have this type of control because it's socialistic in nature, as far as I'm concerned. And I just want to say Proverbs 14:34 says, righteousness exalts a nation, but sin is a reproach to any people. Thank you.
Next up online is Natalie. Natalie, go ahead.
Hi there, can you guys hear me all right?
Yes.
Alrighty, my name is Natalie. I live in the town of Richmond. I am a small business owner in the New Richmond area. My question is on your guys' ordinance, there's a section here that says initiation of legal action. Legal action shall be initiated against a violator as requested by the health officer in accordance with the following. The Office of Corporation Counsel shall be responsible for all cases where a court-imposed forfeiture and/or injunction is being sought. My question to you guys is, do violations of the ordinance go to the district attorney that was just elected, Carl Anderson?
No, because it's a because it's a local ordinance, it does not. The Corporation Counsel's office would be the prosecuting entity for a violation.
Thank you. Adam, you're up next in the county boardroom.
Ken, just one quick comment. I just want to clarify, in the reading of the ordinance, she mentioned the word injection, and I think she meant to say injunction. So just to be clear, injection is not part of this.
Right. Thank you, Dr. McGinnis.
Hi, my name is Verla Gunderson. I'm from Baldwin, and we do not want this proposed ordinance to pass. No one person should have this much authority. COVID-19 has had a very negative effect on our community. Saturday, my friend just lost his daughter-in-law to suicide. She couldn't handle the mental stress from COVID-19. And then that same friend lost his sister the week before. She was in a nursing home and was unable to see her, or he was unable to see her for weeks. This appointed official is setting themselves up for a lot of negative feedback and stress on themselves. I would hate to have that on my shoulders, making all those decisions. We do not need more fear and stress in our lives. What are we going to do when it's flu season? I work in a daycare. The people that were self-quarantined were false alarms so far, and I don't know of any children or anyone there that has had COVID-19. We were sick. There were people sick in February, so we're assuming that we're immune to it already. But I worked in a factory for 33 years. This is pertaining to the mandatory mask thing, and for 7 years, I had a cough that I couldn't get rid of, so I went to a naturopath doctor, tried to stay away from prescription drugs, but I tried everything I could, and I just could not get rid of my cough. And I was so at my wit's end, so I wore a mask. I voluntarily wore a mask, and I had to sign a release saying it was my choice. But I was so exhausted after work because of the lack of oxygen. I had to quit my job of 33 years as I felt I would die if I stayed there with that mask on. And I've been away from there for 2 years, and I don't cough anymore.
All right, next up online is Addison.
Hi, my name is, can you hear me? Sorry.
We can, go ahead.
Hi, my name is Addison, and I live in the city of Hudson. Thank you for trying to get us back to normal. 25%, we had a 25% capacity for restaurants and businesses yesterday, which puts our economy, some people's health insurance, et cetera, at risk. The last shutdown was personally painful for myself because my husband was laid off and we can't afford another one. Hudson School District recently went to hybrid, so I support whatever helps us get back to normal and appreciate all your work and duty to your community. I know public health officials have been resigning due to regular intimidation. This shouldn't happen as you're just trying to do your job, and I appreciate you. And the fact that you are listening should alleviate concerns that you'll be judicious in your actions, and that's all I have to say. So thank you very much.
Thank you.
Dr. McGinnis, there was a question on the couple speakers ago related to masks and the lack of oxygen and that kind of thing. I think there's some, I'm just curious about research about masks and their effectiveness, and then also some of the things that people are worried about having to wear them.
Well, I think, speaking as someone who's been in the surgical suite in the past and has done that, the lack of oxygen related to a mask is not an issue as I see it, or as the research has shown. Certainly, surgical teams wear them for hours on end. We wear them in the office. If I have a cold, I will wear them for a long time when I was caring for patients. So from that standpoint, now you can feel uncomfortable in a mask, and for some people that it makes it feel like it's harder to breathe, and some people just don't tolerate them very well. So that's a different story. Masks have been effective, and I think there's been some fairly good research on that. And the effectiveness is more related to if I have COVID and I happen to be near you, do I spread as much virus into the air or as much virus that you might inhale? And that's where their efficacy really has been shown. The other concern I've heard raised is that masks will make you more sick by harboring germs closer to your mouth. And believe me, your mouth is already full of germs. So I really can't make the situation much worse from my standpoint. And certainly that's not been borne out in the research that I've looked through and looked at as questions have arisen.
Adam, you're up in the county boardroom.
My name is Michael Holtz, and I'm from Wilson, and I am and my family are against this ordinance, and I'm taking a little bit of a different approach to the comments that I've heard, and that is my grandson and his family were in South Carolina, and they contacted the virus brought it home, and then Thanksgiving gave it to my wife and I, and they had it, the four of them, and then it was passed on to my daughter and her 5 children. So there were 12 of us that were infected. How do I know we were infected? Because the wife of my grandson that was in South Carolina, it has autoimmune dysfunction. And every time she gets sick, she goes immediately to the doctor. And she went to the doctor at Glenwood City. He did not know what it was, so he swabbed her nose and also swabbed the 6-year-old. He put them in the freezer, and it wasn't until April that he took the swabs out and had them analyzed, and they were positive with the virus. But all of us have survived. Praise God for that. My wife contacted my 97-year-old mother in the nursing home, and when she got home, she and I quarantined ourselves, and it felt like we had gone through the Asian flu, and so we were quarantined ourselves for 2 weeks. We recovered, and so did everyone else. So I just wanted to share that you will recover if you just take care of yourself. I mean, that's what we do, don't we?
Thank you for that story. Celeste, you are up next online.
Okay, can you hear me?
Yes.
Okay, great. I am asking that you please add version 3 of the proposed communicable disease ordinance as an agenda item for the next meeting of the St. Croix County Health and Human Services Board. And at that meeting, you please recommend the ordinance without any amendment to the St. Croix County Board of Supervisors. I and my husband here in the town of Hudson support adoption of this ordinance by St. Croix County without further delay. This proposed ordinance allows the St. Croix County Public Health Officer to issue and enforce reasonable and necessary public health protection orders. We think that we should allow public health expertise and public health data to drive decision-making about public health matters. And that's what this ordinance allows to happen. We do not think that what to do and when to do what in response to dealing with a communicable disease in our community should be questions that are decided on the basis of politics or expressions of public opinion. The general public doesn't really know what they're talking about, as shown by many of the comments tonight. There are experts in public health and in epidemiology and in law who will guide the county in the exercise of any authority under this proposed ordinance. It should go forward as soon as possible. It would be great if voluntary compliance with the recommendations from our county public health department had been good enough, but they weren't. In just the last 5 weeks, the number of confirmed COVID-19 cases in St. Croix County has about doubled from 650 on September 1 to 1,147 today. And the number of active cases, people actually sick with COVID-19, has about tripled in 5 weeks, from 151 people sick with COVID-19 on September 1 to 415 active cases today. This epidemic is increasing too fast, spreading too widely in our community. We need to have the local authority and ability to issue and enforce necessary and reasonable public health protections. Thank you.
Thank you, Celeste. Okay, Adam, you are up next in the county boardroom.
My name is Rick Mannion, and I speak against this ordinance. My concern is for a number of reasons. One is that we live in a constitutional republic, and that means we elect our representatives. I think it would be unconstitutional to put somebody in charge who is not an elected official. We have no recourse in that regard. And our Constitution begins by saying we the people. So it should be our decision, and we should have a voice in that. And I know somebody used the police department as an example, but with the police department, there are checks and balances. This is giving power to one person, and I am against that. And as a pastor, I'm also a pastor, I am certainly aware of mental and social distancing problems that people can have. We're just looking at a disease here and how it affects us physically. We need to take a look at how it is affecting people emotionally. Suicides are up, alcohol sales are up, and we should be concerned for the whole person and not just the physical welfare of people. And I keep hearing this about there are more cases and more cases. And what we need to look at is not the number of cases, but the number of deaths. And are these deaths directly because of COVID? The McIver Institute has said that in Wisconsin, only 1% of the deaths are directly related to COVID. This is the other thing that concerned me is this is not meant to be temporary. This is something that they want to put in place from here on out. And another thing that concerned me is in the ordinance that says that in extreme cases, constitutional rights may be taken. Well, I'll tell you, when you violate constitutional rights, you're on a slippery slope. I feel like we've been played all along. It was 2 weeks to soften the curve. Quarantine the sick and not the healthy. And the question I have is to the panel is, are the only relief we're going to see a vaccine? And you said you were constitutional, your actions are going to speak louder than your words.
That's right. That's right.
Dr. McGinnis or Kelly, can you speak to the comorbidity?
I'd love to start because a number of speakers tonight have really talked about social isolation, mental health, and I think in public health, we don't do a great job of telling what our department is responsible for and some of the stuff we do on a day-to-day basis. And I could talk about public health all day because that's why I'm here and I love this and this is what I do. Prior to COVID, we engage with all health systems across our county in both Pierce and St. Croix, as well with our schools and many other community members such as yourself and other critical stakeholders in the community. And we do what is required of us on state statute, which is called a community health needs assessment. And we are very, very well aware that our community has identified substance use disorders and mental health issues as our top two priorities prior to COVID. And I don't think we have done a good enough job telling our community how to get involved and how to do community intervention about what that means. That's what we do in public health. That's not the only thing, but that's one of our big focuses pre-COVID. And yes, we get communicable diseases from that list of 72 that comes in daily that we do have to take care of to make sure communicable disease doesn't spread. But I think the point here is because we don't know that much about COVID, that is where this concern is coming from. It has not been around long enough to say we don't know long-term effects. And I think that is where you're hearing or seeing the concerns of why many other health departments across the state are bringing these kinds of ordinances forward. I'll yield.
I was wondering if you could speak to the comorbidity, Dr. McGinnis, and then that the statistic about the number just dying strictly from COVID versus other existing conditions.
And so what I think the speaker is referencing, and I have not seen the Kobler report, so I can't speak directly to that. Be happy to look it up later. But there was a report that came out from the CDC saying 6% of the death certificates listed COVID as the only cause of death. Having filled out far too many death certificates over my career, when you fill out a death certificate, you oftentimes list anything that might be related to the illness. So if you have a heart attack and you have high cholesterol and diabetes and other conditions, those would all be listed. So it was somewhat unique that it was just COVID on those 6%. So that means they had nothing else wrong, and COVID was what was the only cause of their death. Now, if a patient had COVID and happened to have hypertension, they might have lived another 15, 20, 30, 40 years, but COVID took their life. On the death certificate, you're going to list hypertension as well. That's the way you do these things, or respiratory diseases, or diabetes, or obesity. And so when you really look at that data, COVID was the cause of their death because they would have lived much differently and much longer. There was some preliminary data that I saw that said that the average life expectancy lost when somebody dies of COVID is about 12 years. That's a lot of time with grandkids or great grandkids or being a part of the community and all those other things. So while we talk about underlying causes, I don't tend, that should never be written off as meaning they were in a nursing home about to die anyway. I think as I look around our community, if you look at folks that are over the age of 50, probably neighborhood of 50% or more of them have a comorbid or underlying health condition. Generally across our county, the number is about 30% have a comorbid condition, whether that be obesity, diabetes, hypertension, or some of the other diseases listed. So of your friends and neighbors, fully 1/3 of them have a comorbid or underlying health condition. So that's, COVID does kill. There's 210,000 people who lost their lives that many of them may not have and would not have within this year. It's now the 3rd leading cause of death in the nation within a short 8 months. And that, to me, is a big deal.
All right. So I think it was me next, correct? All right. Erica, you are up next online.
Hi there, can you hear me?
Yes,
Hello?
go ahead. Go ahead, Erica.
Okay, thanks. Thank you. So I'm Erica Stuffel. I am from New Richmond, Wisconsin, and I just wanted to start by thanking everyone for the opportunity to have this time this evening. I appreciate that this is an incredibly difficult circumstance and situation for everyone involved. And I appreciate that we are attempting to work together to find solutions that fit the needs of everyone in the community. So my question tonight is, and it was kind of addressed earlier, but I'm not sure I heard clearly, what legal precedent is the county using to determine that certain constitutional rights can or may be suspended in the time of public health crisis or extraordinary circumstances, which seems to be the main issue people have with the proposal or the language in the plan? And to go with that, has the board considered that it might be more effective in the end, which should be the goal, to propose an ordinance that is less restrictive or the least restrictive possible to address any purported health issue, which is generally a best practice with any health intervention? We discussed tonight the other epidemics in this country of suicide, domestic violence, addiction, etc., which should be a forefront concern as well. And that also won't cost taxpayer dollars, as has been suggested here tonight, or make null and void any legislation entirely if faced with any legal challenges and then ends up being ruled unconstitutional, such as what we saw earlier this year with the Wisconsin Supreme Court ruling in regards to Governor Evers' emergency orders. If that was invalidated as unconstitutional, why wouldn't something like this be? Thank you.
Thank you, Erica. Scott, unmute.
There are a number of cases that that lawfully allow for the impact on constitutional rights, and one of the cases is Jacobson versus Massachusetts. There's also a case out of the state involving quarantine or isolating and removing somebody from their house. The general legal standard for anything that involves a constitutional right is that there has to be a compelling state interest. And if there's a compelling state interest to do something, and the courts have generally considered a pandemic to be a compelling state interest, that the government is allowed to narrowly tailor an order or restriction on a constitutional right so that it's done in the least restrictive manner. Any guidance given the public health officer, if this ordinance is passed, would be consistent with those general legal principles. We are certainly very mindful of people's constitutional rights, and we take those very seriously. But as the courts have said, because you have an infection doesn't give you the right to infect other people if the state puts reasonable restrictions in place. So there are all sorts of constitutional rights that are implicated by a myriad of laws. And those laws take into consideration what is the least restrictive manner that those rights are impacted. Thank you.
Thank you. Adam, you're up next in the county boardroom.
Okay. So do you know that none of us want to be here? We would much rather be at home enjoying our families and our friends. We don't want to be forced to take up your time and remind you of what your job is and what it isn't. I've heard you say that we need to make a decision on this, that this is what we are elected for. No, it is not what you are elected for. You were elected to represent the people, to represent us. You were elected to uphold the Constitution. You were elected for promoting liberty. That is your job. And yet here we are, the voice of literally hundreds of people, and you intend to pass this ordinance over us. We don't want to have to spend hours and weeks and months researching because our governor can't stop spreading fear and because we only get biased information on the news. It is not an easy task researching the truth of things, but I can tell you I have. My eyes are wide open, and now that they are, I won't stop till the lies stop and this overreach is done. Not too long ago, I used to trust and really believe that people had my best interest at heart. That trust has been fading, not only at the state level, but where it hurts the most is where my people from my own community that I have lost trust in, my local elected officials. If this ordinance is passed, it will be a sad day for us all. Where is the trust in your people, in us? I mean, do you really think that if we contact COVID, that we are just going to go around coughing and sneezing on people? That we won't understand that we should stay home and protect our vulnerable population? You must really think that we're a bunch of toddlers need constant babysitting. Do you see how ridiculous this is? In closing, I'd like to state that it has been disheartening how those of us in opposition to this ordinance have been treated. We have been disrespected, disregarded, discredited. Our emails and our phone calls have been vastly ignored. We have been made to jump through hoops to get our voices heard. We have been laughed at while speaking, point blank lied to, and blatantly discriminated against. I'm not done, I'm gonna finish. Yet here we stand and we are not going anywhere. Even if this passes, we will be fighting with different means. There are consequences to your actions, spiritual, moral, and legal consequences. If you take your actions without considering the consequences, then I'm sorry, but you are foolish. Question for tonight. If the entire committee Oh, this is directed at the entire committee, but specifically towards Kathy Leaf. We have been asking for extended time for tonight's meeting. What's your plan for hearing the rest of the people here tonight once the 2 hours limit has been met? Because we are not leaving. We will stay, and will you stay and hear your constituents tonight? Thank you.
Well, you need to stick within your 2 minutes. You went a little over. But I will stay. I don't know if the rest of the panelists can stay, but I would like to say that if you have something new to say, that would be great. We've heard a lot of the same themes, but keep going.
All right, next up online is going to be Andrew.
Can everyone hear me? My name is Andrew Ellingbo, and I'm from the town of Hudson.
Yes, go ahead, Andrew.
I'd like to start by saying I support this ordinance. I do believe that, you know, a lot of what we've heard tonight are what if statements. You know, what is the next person going to use this ordinance for, and how will it infringe on people's rights? My question is there an expiration clause in this ordinance so that, you know, maybe a year later from now, that once this is over, this ordinance will expire? Because as we've seen, cases have gone up according to epidemiologists, so people aren't following masks when masks are very appropriate and effective. And I think the people objecting this ordinance need to have their perspective looked at of basically, you know, 210,000 people have passed away from this disease. The population of St. Paul is 278,000. That's almost like basically wiping the city of St. Paul off the map. And I think if people really want to keep our economy open and keep people healthy and safe, they'll wear the masks. And that's the way we can do the best to keep our economy running, to keep people working, to keep people employed and have jobs. So I just say I support the ordinance, and I really appreciate everything you guys are doing. Thank you for your time.
And I would like to answer his question about expiration. Generally, ordinances are permanent in nature until repealed or replaced by the governing body, in this case, the county board. There are circumstances, and certainly the county would be in its discretion to put an expiration day or sunset. That's something for the policymakers to decide.
Thank you. Adam, you're up in the county boardroom.
Before I call up the next person, Kathy, can you repeat your answer, your last answer? The people in the room did not hear that.
Oh, I did say that if I would like to have people that have different things to say, because we have had a lot of similar comments. If there's some, I would like to prioritize those if possible. But that I am willing to stay and listen. But I ask that you do, if there's a lot of similar comments that we've heard that. So keep, like, if there's new things, start with that.
Let's move on to the next person so we can keep this meeting moving. If you could step up, please.
Good evening. My name is Sherry, and I'm from the Somerset area, and I can't be as eloquent as some of my friends have been from Roberts and Baldwin and the other areas around here. I want to leave no doubt I am opposed to this ordinance. I think it's overly broad. It lacks definitions, it has no end date, and it tramples on my constitutional rights. So I'm extremely opposed to it. But let me say it a little bit this way. I have friends who are vegetarians. I don't mind that they're vegetarians. If they want to eat bean sprouts and mushrooms and toadstools, I really don't care. That's fine with me. But don't make me do that. I raise cattle. Don't make me live on bean sprouts. Don't make me do what I'm not going around licking doorknobs. I am being cautious. I try to take good care of myself. I'm in the older category. However, I want to live my life. I want to have the freedom that God gave me, the freedom that our country was founded on, and I want to stay with that. I heard Benjamin Disraeli quoted. I would quote Benjamin Franklin, who said, "He who is willing to give up essential liberty for temporary security deserves neither liberty nor security."
Online is Kelsey up next.
Hi, can you hear me?
Yes, go ahead, Kelsey.
Great, thank you. Hi, my name is Kelsey Janetsky. I'm a homeowner in Hudson, Wisconsin. I currently shop in Minnesota and spend all of my money in Minnesota because I do not trust the residents of Hudson, Wisconsin to protect my safety. I work for a company based in New York City. My best friend lives in an apartment building that has a trailer full of dead bodies parked next to it. This is a real thing that is killing hundreds of thousands of people. It's not real here to everyone now, but it is for them. I talked to her through March, April, and May as it affected her and locked her in her 800 square foot apartment. It's terrifying for them, and the fear was real, and I watched it every day on their faces. I worked with them remote. We talk about how we should be able to be free people and make our own decisions, but when this affects all of us and it's asymptomatic, we are not acting like adults. We are acting like toddlers, and we are making choices that affect other people and can potentially kill people. So I'm in full support of this. If we had followed the rules in the first place and we had followed all these restrictions and our elected officials like our sheriff had actually enforced the rules, we wouldn't be in this position. But because we can't act like adults, this is where we're at. And people are dying. Our numbers are going up. I think this would be short if we could follow the rules and play safe, but we're not doing that. So that's my comment. My question is, how do we plan to protect the safety of this person if this is passed? Because I think from what we can see here in the last couple meetings, I would be concerned about the safety of this person. Thank you.
Yeah, if you think you can answer that, Kelly, or?
Well, is she talking about my safety?
Yeah, I mean, if you're going to go around and talk to people, absolutely.
Well, here's the deal. I try to.
COVID, so.
No, that's great. And I really appreciate that question. And I got a little teared up when I talked about my grandfather in the 101st Airborne. I'm a person, just like all of you. I did not, I tell people this all the time, I didn't take this job to write tickets or to be an enforcement authority. I truly believe in protecting health and safety of people. And I'm not scared for myself. Maybe I should be. I know others have said they are. I don't think anyone hopefully has it in them to actually do anything personally that will attack me. I don't know. I'm not worried. I know people have mentioned, maybe you should be a little worried, but I'm going to serve for St. Croix County.
Adam, you're up next.
Again, if I may, for just a minute.
Go ahead, Dr. McGinnis.
I've served on the Health and Human Services Board for a couple of years now and have known Kelly through that time. And I firmly believe that she will do everything possible to avoid writing a citation or coming down hard or heavy on somebody. It's going to take somebody doing something really, really stupid before that happens. And so I think her credibility in this, her care in this, is nothing that I haven't seen consistently, even before COVID started, and her real genuine concern for the residents of the county, including those who are very opposed, is truly evident. So I think that it's important to remember on the one side of these attacks are real human beings who do have a lot of care and a lot of concern instead of sometimes the monsters that folks are trying to portray them to be, and that's not the case at all.
Thank you, Dr. McGinnis. Adam?
Hi, my name is Shelley Vance. I am a Hudson resident, and I am also here to oppose the communicable disease ordinance like many of us are. There's probably about 100, I would say, maybe 150 of us here. I wish you guys all on Zoom could see us here standing up. I want to talk a little bit about fear. There are 11.2 deaths per 100,000 people in the US alone that die from car crashes, with over 5 million crashes total. 3 million serious injuries are reported yearly, contributing to years of chronic pain, disability, and not to mention early death. I have a fear of dying in a car crash. I'm asking that you stop driving as much. When you do drive, avoid the middle lane. If cars stayed much further away, we would see fewer crashes. Highway safety data confirms this. Please keep a recommended 100-yard distance between cars at all times. Next, if you could avoid driving except to get groceries, that would make me feel much better. Many people's jobs are not that important, so please stay home, save lives. With that said, we won't get back to normal driving conditions until we have updated technology that protects me from you and your poor driving habits. We are waiting for vehicles that remove your personal responsibility and decision making. This is the only way we're getting back to normal driving, because you are clearly not capable of keeping yourself or others safe. Texting, eating, talking on the phone, laughing, etc. are all examples of behaviors that cause more accidents. None of these behaviors are my choice, therefore, we must all stop driving as much to avoid these behaviors. This scenario is utterly worthless. No one would ever consider following this, yet this is where we are today with COVID. It's a very huge misstep. It's misguided, disruptive of living. Translate this to COVID today. If your immune system is strong,
Please
why would you
now.
fear environment? If it's not, why would you not change it? Simply saying, like, fear does not stop death, it stops life.
So we're going to move on to the next speaker.
Thank you for
next
listening.
Speaker is an online speaker, Peter.
Hello, my name is Peter Eich, and I've done the work. I believe it's your civic responsibility, if you have symptoms or are sick, to stay home. In crimes, we require a standard of proof, but even the idea of presenting But even the idea presented by a speaker earlier saying, quote, resign your rights as a citizen, give it a shot, is appalling. In this ordinance, the unelected St. Croix County health officer can take action if they, quote, suspect or is informed of the existence, unquote. And from that, they can restrict anyone, take them from their home. This requirement is too low. Quote, all measures necessary, quote, is a slippery slope. Life is dangerous. I understand the risks of COVID and know people who have both survived and passed by complications of the disease. The greatest fear in St. Croix County right now isn't COVID-19, but it's this ordinance. If the county were truly interested in the health of the citizens, it would make available inexpensive therapeutics which are known to be effective with SARS-CoV-2, so we can avoid the full impact of COVID-19. I am opposed to the ordinance. My question, how did the county survive SARS, swine flu, STDs, etc. before COVID without an ordinance like this? I yield back my time.
I can definitely take the communicable diseases, not to SARS. I think you're referring to SARS that happened in 2003, which I'm sure Dr. McGinnis can discuss, that those two SARS-CoV viruses are very different. I will tell you, we are not surviving the STD pandemic at all. Our STD rates in this county are unbelievable. But we aren't seeing deaths from chlamydia and gonorrhea. We see a whole host of other problems that happen with those, such as infertility and other medical problems down the road. But they aren't killing people, and they aren't filling up hospital beds to treat other people with that have other conditions that need to be taken care of. I'll yield to Dr. McGinnis.
I think related to the other two coronavirus concerns, the MERS and the SARS, both those were a major concern. And in fact, we changed some of the protocols in our offices on CDC guidance related to those. I think the difference has been is that both those infections went away pretty quickly and really just kind of died out. So we never really saw a huge amount of that coming across the shores. This particular virus, even though it's in the same family, is behaving very, very, very differently with wide scale spread, much more serious consequences involving many more organ body systems. Some scientists are feeling it's related to the fact that there is a lot of droplet and aerosol spread. There also seems to be a reservoir that's developed in the population that allows this virus just to be present and wait for folks that are not taking appropriate precautions or communities that aren't doing a good job, and then it will tend to express itself. So same family, but very, very different results in terms of what this has done. When this first came about, I was thinking it might be like SARS or MERS back in January and February, but it turned out not to be the case at all.
All right, Adam, you're going to be up next in the county boardroom, but you'll need to unmute the Surface device first.
We're going in the order here.
All right, you should be able to go ahead now, Adam.
Hi, my name is Lisa Buckle, and I'm a Hudson resident. I live at 1286 Cratley Lane. I'd like to first address Scott Cox. Your statement that at times it is lawful to allow for limitations of constitutional rights for a compelling reason. That our rights can't infringe on others' health and welfare, their health and their safety. Well, there have been times in our nation's history where rights have been granted that infringe on others' health, welfare, and safety. I can think of one such Supreme Court decision that decided it was okay to deny the constitutionally protected right to life to innocent American citizens. From the moment of conception, a fetus in the womb is legally an American citizen with its own DNA. Yes, if a woman is killed when she's pregnant in a domestic violence, it's a double murder because that baby is protected. They are entitled to enjoy the protections of the Constitution. Yet our Supreme Court turned their backs on the Constitution and these individuals by affirming a right to abortion. This does not make it right, though. This does not make it ethical. If you are intent on telling us that you will pick and choose how you will support the Constitution, then I respectfully ask you resign your post as you swore an oath. You swore an oath to be on the board, to uphold the Constitution, not to pick and choose. Please open your seat to someone who will faithfully discharge their duties as far as honoring their oath. There's been between 100 and 150 people fluctuating here tonight as we were limited physically on how we could be in this building. From the Declaration of Independence, the government is instituted among men, deriving their just powers from the consent of the governed. Well, we here are the governed, and you derive your powers from our consent. And my hope is that you will listen to your peers and neighbors here tonight who are telling you what they will and will not give their consent to.
Next up is John Gostovich online.
Thank you all very much. I appreciate your patience and the respect with which you're treating all the speakers. I especially want to thank Elizabeth and Scott and Kelly and Kathy and Paul for working so hard to put the welfare of the citizens of the county and to protect that welfare first. I have a great deal of respect for public health folks. The United States doesn't put a lot of money and a lot of resources into public health. I worked for years at the Minnesota State Department of Health, and the epidemiologists there would work 24 hours a day, 7 days a week to find what was making a bunch of people sick or killing them and come up with some sort of reasonable solution. They worked for all of us to save our lives and to keep us healthy, and that's what I think you guys are doing tonight. Quick comment, I'm getting really tired of a bunch of people who are not attorneys telling me what freedom and liberty and what my Constitution means. In our system of government, the United States Supreme Court interprets the Constitution. There was a point when our Constitution allowed slavery. There was a point when our Constitution didn't allow women to vote. For some reason, unelected officials require that I wear pants when I come into St. Croix County. And I don't have the liberty to build a rendering plant next to a church. I don't see people all hot and bothered about any of that. They probably love it. As for the creeping socialism, I wish the people on Medicare would stop talking about that socialist program and give it up. I'm sorry,
John.
I'm angry as I am. Thank you all for the work you're doing.
All right, Adam, you're up next in the county boardroom.
I'll speak directly to the caller that just called in. My name is Jessica, and I live in Hammond, Wisconsin. So back in May, when Governor Tony Evers' order was overturned, it was due to a few different things. One of them was constitutional doubt. The wording, reasonable and necessary, created a problem. It meant that your constitutional rights could possibly be jeopardized. So, yeah, we're protected by that. What I really wanted to talk about, though, was where the guidelines come from that we're going to be talking about with our health officials, the Wisconsin Counties Association. If you go on their website, you can look at their guidance recommendation. At the end of the document is an appendices. I'm just going to read the topics to you. These are affidavits that are signed by a notary that can quarantine and isolate you. So they list as communicable disease confidentiality agreement, notification of release from isolation, administrative directive for isolation, notice of rights of isolation or quarantine, petition for court-ordered isolation or quarantine, court order for isolation or quarantine, isolation quarantine place card, you can put that on your window, administrative directive for closure, contact tracing, medical evaluation, notice of rights of administrative directive, petition for court order for, and you can insert the action. A couple highlights from one of those fun documents. The administrative directive for isolation states many things, but a couple things that are really alarming. In order to ensure that you strictly comply with isolation order, the department or persons authorized by the department will monitor you. If you prove not to comply with this order, a quarantine officer may be placed at your home until your isolation order has ended. If you fail to comply with this order, you may be subject to 1, a citation, 2, an order to isolate in a more restrictive facility, or any other relief available by law. My question is, does our board intend to use these documents to quarantine and isolate people? Thank you.
Do you want me to start, Scott? Scott Cox, do you want me to start that?
Sure. I think the answer is those remedies are already available in law, but you can talk about that.
Yeah, that is so Kelly Ingen, I was going to talk about that a little bit. We currently have what we call, it's part of our public health emergency preparedness plan. It's called the isolation and quarantine plan. We already have that. use it when we have active cases of tuberculosis. Since I've been here, it's almost 2 years to the day I've been here. We have not had to use isolation quarantine as we have not had an active tuberculosis case. I think as COVID happened and we are in this response, for the most part, the St. Croix County citizens have really complied with the phone calls they're getting from public health. They have said to us, yeah, I'm sick. I don't want anyone to get this. I'm going to stay home. And that's been the overwhelming response. We have seen some resistance and people who don't want to give us our close contact, give us their close contacts, which that's all a part of this response of public health's responsibility, to do contact tracing. But that's exactly what I was going to say, Scott, is we already have isolation and quarantine documents such as the appendices that Jessica referenced there in another document. So.
Did you need to clarify at all, Scott, or are you good with the?
No, I'm good.
Okay, very good. All right, next up then will be online, Rebecca Paulson.
Hi, can you hear me?
Yes, we can. Go ahead, Rebecca.
Thank you. My name is Rebecca Paulson. I live in Baldwin. I, like most of the speakers tonight, I'm very opposed to this ordinance, and I won't go through all the reasons for them. Sherry kind of stole my thunder with her quote from Benjamin Franklin, but I think it's very applicable in this situation. I do want to say that as a mother, one of the things I'm seeing with my kids who are teenagers and adults is that the effect of a lot of the COVID rules, I'll call them, are starting to take a really strong mental toll on them. And I feel like more rules and more restrictions and more government overreach is not going to help. I don't doubt that Kelly and Elizabeth and everybody else that's involved in this have good intentions and that they're good people and that they don't have any intent to do anything to harm people. But I've seen it happen in other places where that's not the case. And you may not be in these roles for a long time, and this is a permanent ordinance. And there isn't any, as far as I can see, any plan to reverse it or to change it or to make it less broad or less intrusive into our lives. And I think what people are concerned about is the proverbial camel's nose under the tent. We've seen an awful lot of changes in the last few years. I'm over the half-century mark, and I remember a lot of things that were a lot different when I was a kid from what they are now, and I don't think that most of them are good, especially with the changes in the way that government runs our lives and intrudes in it. And I would just like to caution this board that adding something that has the potential to infringe on people's liberties this much is dangerous. And it's dangerous not just to us, but to our children. And I'm concerned about that. I don't have a question, but I just wanted to voice that concern.
Thank you, Rebecca. All right, Adam, I'll turn it back over to you for the county boardroom.
Was that me? Okay.
Yes, sir.
Okay.
My name is John Salmi. I live in Hudson, Wisconsin, and I want to state that myself and my wife are strongly opposed to this ordinance. All I want to do is talk about some numbers. As of 4:30 this afternoon, the total number of COVID-19 tests executed in the county were 18,676. The total number of negative tests were 17,529. The negative rate percentage is 93.85%. 93% negative, okay? The total positive tests, 1,147. That is about a 6.1% rate. The total number of deaths so far in our county have been 9. Any deaths suck. We have had 9 deaths on account of this disease. The total death rate as a percentage of the positive tests, here's where it gets good. 0.7%. 0.7%. The total death rate as a percentage of the total tests, 0.04%. Do the math. The population of our county is 91,868 souls. The mortality rate in St. Croix County as a percentage is 0.0098%. My chance of not dying from COVID-19 today, 99.9902%. So, we've got some cases. We've got a lot of survivors. Out of those 1,147 cases, we have 723 who have recovered. 415 are currently active, and we've lost 9. Any soul lost is bad. However, what constitutes an emergency? 0.04%? Thank you.
All right. There's no panelist response to that. I'll move on to the next online.
I think
yeah.
Dr. McGinnis and I can both speak to the way you look at a mortality rate. Of course, only 9 people have died, and we all agree that that is horrible. But I think there's a big picture here that isn't captured on our St. Croix County dashboard, and that's the people that seek care due to COVID complications from COVID. So those who are entering our emergency rooms or those who are hospitalized. Our numbers of current hospitalizations have been low, but if you look at kind of what's going on in Fox Valley, hospitalizations can become on the rise. So there is a morbidity, which is kind of the effects to your body, and then there's mortality, the ultimate worst outcome that can happen from COVID. And so I think it's important to look at the big picture when we look at the effect of this disease within our community and within our state and within our country as a whole.
Thank you, Elly. I think that was, I really don't have a whole lot to add, but it is a combination of both that morbidity and mortality. And the goal here is to hopefully keep the number of people who catch this disease down so that we can save as many lives, save as much morbidity as possible, and keep things as open as we can. Because we don't have an effective outpatient treatment for this. The only treatments that are really shown to be effective are those that occur in the hospital among the sick and sickest of patients. And that's the hard part.
All right. So next up will be online with John Lestock. John, I have your line muted right now, but can you unmute? All right. John might be away from keyboard. So we'll move on to Christy Emerson. Kristen Emerson, sorry. Go ahead, Kristen.
Hi, can you hear me?
Yes.
All right, so I'm going to go ahead and say I fully support the ordinance. And if you're making tallies, I'm going to say it again. I fully support the ordinance. I want to personally thank Scott Cox, Paul McGinnis, Elizabeth Clausen, Kathy Leap, and Kelly Engen. I know you're putting yourselves out there, and I know that you actually have had issues with your own safety, and I so appreciate you, and I know that a number of people do. My first question, or I guess my only question, regardless of comments today, I know there's a number of people in the peanut gallery there. Will you be taking into account comments that are online, in email, other forums besides the things that are happening here? And then I also want to make a comment. I know there was a man that talked about his family that had COVID and they all survived. And I guess my comment to that would be, what do you say to the 214,000 people who have family members who did not survive? I mean, super for you. It's not because you took your vitamins. COVID doesn't really discriminate. So I'm glad you and your family are safe, but that's not the case for a lot of Americans. Wisconsin is a huge hotspot right now in America. And I think St. Croix County is probably an anomaly in America, Wisconsin, and in the world as far as pushing back against the mask nonsense. So that's my comment. Again, I want to say I appreciate you guys more than you'll ever know, and I think so many people do as well. So I will take my time back or give it to whoever. Thank you.
Thank you, Kristen. I think her question was, are you taking additional forms of input?
I would say definitely. We have a long public comments at county board meetings, subcommittee meetings, HHS meetings, countless times, emails, phone calls, yes.
All right. I will just point out the statistics here. We are at the 2-hour mark. We've gotten through just shy of about 40 speakers, so we're averaging about 20 speakers per hour. I know that I have another 16 online out of the 120 that are online, and that we have a number of people in the boardroom yet. I think the last count Adam gave me, we should still have probably in excess of 40 people that had requested to speak. So we should be able to wrap this up if you wanted to continue in about 4 or 5 hours. Or we could take this as a sampling size based upon the input that we've had, or whatever the chair likes at this point. So I hate to put you on the spot, Chair Leaf.
That happens all the time.
Yeah.
Well, the panelists are the ones that I like to confer with. Would you be willing to do another half hour? And then the rest of the comments would be submitted.
I'm willing to sit here for another half hour anyway, and if there's questions and answers in the Q&A section that aren't answered, let's make sure they get answered after the fact and published.
Correct. And I'm wondering if we could prioritize both online and in the boardroom, people that haven't had a chance to speak previously, maybe at another meeting, because the other folks that have spoken before are on record already. So if there's somebody new here that hasn't had a chance to speak tonight, please, if there's a way to prioritize that, I think that seems fair.
All right. So Adam, you will be up with the next question in the county boardroom.
Yep, and so we have a order that we're following within the county boardroom. It's front to back, from left to right. So we're going to continue with that, and the next person is, nope, it's in the back there. Oh, okay.
Excuse me, Adam?
Yes.
There's a lot of Amish people here that had to get rides and such. Can we get them in? For sure. And then Adam, I think we're all fine with that. And not one response to any of my questions. And I'm just listening for questions.
All right. Yeah. My name is Kyle Schaefer. I appreciate the opportunity to speak to the board here today. I guess I just have a challenge more than anything. Mr. Cox, obviously an excellent attorney, and a lot of what he says should hold some weight. However, let me say I am opposed to this ordinance. What I would say here is that multiple members of this board have repeatedly stated that the ordinance is not intended to accomplish what it clearly states that it will do, or that the health officer has the authority to do. And really what I would like to challenge this board to do is, rather than take an ordinance that was drafted down in Madison, that was sent to you, listen to your constituents, do your job, and draft an ordinance that is narrowly tailored, Mr. Cox, to accomplish what this board and your constituents would have that ordinance state. There is opportunity, obviously, for discussion on this. And really, there's a lot of real concerns here. This ordinance is applying to the masses in its entirety. However, we all look at the populations that are actually affected by this virus. Why would we broadly apply this? And really the one issue that I want to raise is it's stated that you don't anticipate that this ordinance would be used to remove children. State that. If that is your intent, state that. Thank you.
So I will address that. I thought I did state that that is the intent, not to remove children. Every situation we've had thus far in this COVID response, when we ask people to voluntarily isolate, and I think we need to be clear here about isolation versus quarantine. We isolate the sick, so the people who already have COVID, and we quarantine the well, or the people who have been exposed to somebody who has been sick or diagnosed with COVID. In all of those cases, if they have impacted children, family members have taken care of those kids in their home setting. And that has been the case for the last 7 months, and I don't anticipate that being different. Your points about the language being broad are well taken, but I do feel like that's out of fear as well. The unknowns, and I guess I'm going to yield there, but just so you know, nobody has been taken out of their homes to be isolated or quarantined to this point in the response, and there is no intention to do so.
Okay, thank you. We'll move to online with Morgan Ritchie.
Yes, hello, can you hear me?
Yes, we can. Go ahead, Morgan.
Thank you, everyone. First off, I would like to thank you all so much for the opportunity to speak to you all today. I understand that emotions get heated and that this is a difficult time for everyone involved. I am a proud resident of Hudson, Wisconsin. However, I am not proud when my community will not listen to trusted health experts. I am in full support of this ordinance, and I encourage the board to pass this ordinance. There are so many issues at play here. This virus is not political. It does not discriminate based on politics. This will attack our community, and we need to fight back. I thank everyone for their time, and please, please, please pass this ordinance. I understand that many people do not recognize this as a problem right now. It will come for our community, and I just hope that we will do something before it becomes too late. Thank you.
Thank you, Morgan. We'll go to Adam in the county boardroom.
I'm Jen Flanders from Wilson, but I am actually reading comments from the Amish community that we have outside the hallway. They do not want to be recorded with video. So they gave me these to read. Please give me the full 2 minutes. Please, this is Yura Gindrich. I'm sorry if I don't say their names correctly. Please let us keep our religious freedom. Please do not force vaccinations. Please let us take care of our families, our children. Let us support ourselves. Please let America keep its constitutional rights. Amos Miller. We are concerned about all the ordinances that are coming up tonight, and most of this would interfere with our freedom of religion. And I understand that if we would take the COVID shot, it would have the chip in it, and we are very opposed to that. It seems the whole package is against the Constitution. Please listen to the voices of the people. Irvin Miller. We are concerned for religious freedom also on vaccine, considering the chip, etc., and that the health department would have so much power at our homes and private school that has been very much appreciated for what state have allowed us for us, Amish communities, and we are very thankful for what has been done years ago through our forefathers. We would like to continue a lifestyle like this. We would thank you in advance to take this into consideration. Calvin Miller. We live in a religious freedom country, and I stand for it. I am not for all that is going on, and I disagree for the health department to have the right to come in our homes and schools to check on our children, to check on us and our children. Let's keep what we had. Our goal is to live and eat healthy. Also, we have home remedies for our sicknesses, but if messaging you, or but if necessary, we go to the hospitals and doctors for help. Harvey Miller, we are concerned about our freedom and our religious freedom, and also are concerned about vaccines and the chip. We're very much opposed to these two. Please don't take our freedom. We want to be law abiding as long as it doesn't go against our religion.
If I may, I know the Amish community can't hear these comments because of the technology and their beliefs around that. So I think that's something that we should pay attention to in the future and make sure that we're providing some level of appropriate access for those folks as well. But I want to reassure them that I have not seen in any of my research or in any of my studies or in my career as a physician anything that would be related to some type of placing a chip into somebody through a vaccination. That simply is not and will not happen. So I know they have different feelings about vaccines. That's a different topic, but I wanted just to reassure them that at least from my standpoint, I see that is not something that they should have to worry about or that will occur. And certainly I would be very opposed to that because I don't think that that's right.
Thank you. We'll go online to Reed.
Hi, my name is Reed Filiatro. I'm a resident of Hudson, and I am for this ordinance. This is a matter of public health and safety. Stop listening to people who don't believe in science. You know the numbers. You know how our county is doing. Not well. You know that this is not going to get better until we take it seriously, and you can't take it seriously if you keep catering to those who don't prioritize the health, safety, and well-being of our community. Cases are soaring. Even with a mask mandate, they don't follow it. There's a mask mandate right now. How many of the people in the boardroom are wearing masks? So no, apparently they can't be expected to take this seriously and do need to be babysat like toddlers. This is getting embarrassing. Following basic health guidelines is not oppression. Selfish individualism is not freedom. They can politicize a pandemic, but you don't have to listen. This isn't going away until you do something, and you know what you need to do. Listen to the doctors, listen to the scientists, listen to the virologists and epidemiologists, and stop indulging people who get their news from social media and YouTube. And for the record, slippery slope arguments are a literal logical fallacy. In other words, stop listening to them. Thank you.
All right. Thank you, Reed. We'll move to the county board. Adam?
Good evening. My name is Jim Kaler from Hudson, and I had two articles I'd like to share with the board, but I want to read a few excerpts out of both of them. First off, though, the lawyer that spoke earlier mentioned the Wisconsin Counties Association. I really have a hard question to know. The Wisconsin Counties Association is not a legal entity. I mean, they are not elected officials, and I'd like to know why are all the counties following their guidelines. But anyway, with my, this is an article on what they did in Sweden. And the Swedish strategy is that although most countries opted to impose shutdowns to counter the spread of the coronavirus, Sweden consciously chose to alternate path of self-imposed social precautions without state regulation. The Swedes enjoyed normal life almost completely unimpeded. Swedes did not stop flights nor close national borders. No national emergency was declared. No stay-at-home orders were issued. Workplaces continued to function even as work at home was encouraged. Primary schools, hairdressers, shop centers remained open. Public transportation, cinemas, libraries, restaurants, and coffee shops continued to function. And I think you really need to look at this. There were some deficits when what the Swedes did, but it was still very successful. The other one is an article that appeared back in May. It was by 600 doctors who wrote an open letter to the President of the United States saying their concerns that the measures of the shutdown were more harmful to people's lives who did not have the virus than the virus was themselves, such as emotional distress, such as missing routine checkups, and other health concerns. And so I'd really like you to read that article as well. Thank you.
Thank you very much. We'll go to online. Brandon? Go ahead, Brandon. All right, so I'm not getting a response from Brandon.
Sorry.
Oh, there we go. All right, almost lost you, Brandon.
Yep. All right. I am Brandon. I live in Somerset, Wisconsin. I strongly oppose this ordinance. I feel that it's an overreach of government and would like to remind everyone that it's our constitutional right and duty to defend ourselves and neighbors from tyranny. Even discussing the possibility of allowing an unelected official and someone that is not part of law enforcement to enter a resident's home is tyranny. Regardless of whether or not there is a current ordinance enacted giving somebody that right, you do not need to ask permission to stand up to this. My question is, how does the board plan to enforce this ordinance when such a large number of our constituents that put you into the position you're currently in clearly do not support it?
Was that your question then, Brandon?
Yep.
Okay, we'll go ahead and have them answer then. Thank you.
So Kelly, I can start, but we would deal with it as it occurs if the ordinance is adopted. Clearly, both prosecutors and enforcement authorities have discretion whether to enforce the ordinance, under which circumstances they're going to do that, although they should do so in an even way. But we'll handle it as it comes.
I'm sorry, I didn't jump in there. I thought the question was for the board. And I don't, does that mean the panel, like us? I'm sorry if I missed that. I'm sorry. I think that's a good answer. I talk too much. I yield.
All right, we'll go to the county boardroom then. Adam?
Hi, my name is Christy June, and in speaking against what Reed had to say from Hudson, I am educated in science and I've been working in the medical device and pharmaceutical industry for over 25 years and have direct experience working with masks, and this is where I stand. I am against this ordinance, which is a violation of our constitutional rights. The county board are elected officials in which we expect you to uphold our legal rights. I am against allowing an unelected official to decide on behalf of everyone. This ordinance is a direct violation of our freedoms and liberties that our soldiers have fought and died to protect. As a parent of a high school senior and a college athlete student, I am shocked by the testing, and over-testing of our healthy individuals. They're not given a choice, but instead are threatened with expulsion. This is not a pandemic, but scamming people and falsifying data with weekly and every other day testing of college athletes. It's an inaccurate case overload. The children of our community and families are muzzled, quieted, voiceless, and faceless. This is impacting our mental health and causing a spike in suicides that is much higher than COVID death. This isolation is unacceptable. Why must you insist on testing healthy individuals when it's clear transmission doesn't occur without illness? It's pretty simple. If you're sick, stay home. There is no justification to control the community and quarantine into COVID camps. Thank you.
Thank you. We'll go to James Hartigan online.
Hello, can everyone hear me?
Yes, James, go ahead.
Hello?
Yep, we can hear you, James. Go ahead.
Perfect, thank you. Members of the community and the county board, thank you for the time to make this short statement. My name is James Hartigan, and I'm a citizen of Hudson. Patrick Henry once said to guard with jealous attention the public liberty and suspect everyone who comes near that precious jewel. This board is probably aware by now that they have their fellow community members' suspicion. Mr. Cox has very eloquently explained throughout this hearing that constitutional privileges are sacred, but can be curbed and diminished if the need is great enough, if the danger is great enough. He also expressed that these rights should only be reduced by the smallest extent possible and in the least restrictive manner. The way this ordinance is currently drafted extraordinarily fails at accomplishing this. It uses qualitative, not quantitative language to define when a bureaucratic position can assume total power. We've been asked to trust that this will never be enacted except in the worst catastrophes. However, this year we've seen the very worst abuses of this trust. Across the country, including in our state, governors and mayors have overstepped their executive powers in ways not historically seen before. In order to do so, they have misused their health agencies to consolidate this power. Next door in Michigan, the Michigan Supreme Court said yesterday about Governor Whitmer's similar protective actions that no individual in the history of the state has ever been vested with as much concentrated and standardless power to regulate the lives of our people. This board is flirting with earning a similar description. I'm sorry, but this ordinance needs work. I vehemently oppose this ordinance in its current form. I beg you to go back and rewrite it. I yield back the remainder of my time.
Very good. Thank you, James. We're at 7:22, so we'd extended to 7:30. So I'm just giving a short warning that we're getting close to the next time limit there. But we're up next in the county boardroom. Adam, go ahead.
Hi, Philip Hokinson from Baldwin. First thing, I wouldn't want any of your jobs. They sound pretty bad. Not to say that as a bad thing. It just sounds like it's very difficult. I'm opposed, strongly opposed, on behalf of my family as well. Three things that I just want to highlight if I have enough time to do it. First, it denies my rights to religious freedom. As read in section 8.4, it gives the health officer the right to close any place of public gathering deemed necessary. A church is a place of public gathering. This is against my personal religious belief, and that I cannot be allowed the opportunity to meet. This is an attack against my personal freedom, and it's a form of communism, and I strongly believe no individual person, such as a health officer, can dictate as Nazi Germany or Communist Russia what religion I practice or in the manner in which I practice it. Secondly, it denies me the right to handle my health in a way that I see fit. According to section B.2, it says that it can be, I can be forced or be made to have an examination done, by the health officer. This does not, they do not have to have proof to come to my house and force me to have an examination, but they just need to suspect me to have the disease if communicable disease might be present. This is intrusion of my privacy. It is unconstitutional as it does not ensure the domestic tranquility, nor does it secure the blessings of liberty to ourselves and our prosperity. That's in the Constitution, if you wanted to know. It will not be enforced to any health. I will not be enforced to any health examination unless I see fit. This is inappropriate, and I'm strongly opposed to it. Third, and most importantly, aspect of the ordinance is its ability to force someone into some undetermined isolation or quarantine, which Kelly, you have kind of defined that a little bit. So. Thank you for that. But in section B, point 2, it says that a health officer has the ability to enforce someone into quarantine, isolation, and put restriction upon someone. Mind you, the health officer, according to the statement, only has to have reasonable belief and no actual proof. And I'm almost out of time here, but just wanted to say I strongly oppose it. And I want to live in Sakura County. I want to have a family here. But if this is happening, I'm not going to be quite frank.
Thank you. So the next person up to talk is XT 1585. I think I saw that in Star Wars. XT, are you there? Their batteries must have died. We're going to move on to the next one. All right, so the next one is Melanie. Melanie, are you there?
Yes, hello, can you hear me?
Yes, I can. Go ahead.
Hey there, I wanted to only utilize my time since it's very short. The lady with the blonde hair spoke at 7:18. I honestly wanted to say basically the same exact thing, so please reference that for mine so that I'm not taking other people's time that have the same exact message. I am opposed to this ordinance. I do believe that if you were to rewrite it, I don't see why Kelly couldn't do this temporarily, but temporarily I think is got to be the word here, because hopefully COVID-19 is going to have a vaccine and hopefully we're all going to be able to get back to our normal lives. But I think having this as a permanent thing is very, very dangerous. And I do, Paul, I saw the grimace there. I know normal isn't going to be normal forever, and I don't know what normal is ever going to be again. But I do think that having a health official that is not voted into power, if you want to make a new type of a board section and have us vote on it as we the people, go for it. Let's do that. Go ahead and ratify something like that. But hear from the people, speak to the people, and Kelly, run for it. That'd be awesome. I would love to vote for you because I think that you're fantastic. And from what I've seen from here, but I just think that this shouldn't be an ordinance that should be put in place without a vote. Thank you.
All right, thank you, Melanie. So we'll go to the county boardroom. Adam?
Hello, my name is Jim Boschutz. I'm from North Hudson. I referenced that I'm an electrical engineer and I can talk to you about math all day long. And I'd just like to give a couple anecdotal references. One of the gentlemen here tonight spoke about the numbers associated with the deaths in St. Croix County, 9. We have a population in St. Croix County of about 91,000. Just to do the math, the average human, all pardon to some gentlemen in the room, has about 100,000 hairs on its head. Just to put that number, 9 versus the 100,000, that means that the human head lost 9 hairs. The remaining hairs are still there. My point is that we're trying to penalize the remaining hair on our head for the 9 that fell out. Do you understand that? Okay. I'm opposed to this ordinance for a number of reasons. I'd like to share a few anecdotes. First, Dr. McGinnis, he sounds like he's in favor of this ordinance. One of his fellow physicians at the Hudson Hospital, good friend of mine, Dr. Kevin Hellman, he's the one who shared that article about Sweden with me. okay? He believes strongly, and he very much opposes this ordinance, and he is a cornerstone individual of this community. He recently retired and has moved to Southwest USA. So keep that in mind. Dr. McGinnis, all respect to him, another doctor says that's BS, and you got to keep that in count, okay? I'd also like to share anecdotally, because I'm running out of time, I volunteer a lot of my time, Habitat for Humanity, free bikes for kids, and so on. And so, because I'm doing Meals on Wheels, I proactively had myself tested just to make sure. I had no symptoms whatsoever. I was found COVID positive. I was locked down for 14 days in my home. I was required to report twice daily to the CDC my health conditions. I had zero, and everyone associated with me had zero conditions, yet I was locked down. The authorities were notified. The authorities were notified that if I moved from my house, I could be arrested. This is what you people are representing to us.
Thank you.
No, listen to me. I want to be able to do things for individuals.
All right.
Okay?
So
don't
the time limit
stop
is
me
expired.
from doing that. Don't stop me.
So it is 7:30 now.
Oh, you
Yep,
guys.
I'd like to thank everybody that attended, both virtually and in person, for your opinions. We appreciate all of the feedback on both sides of this and realize that we're all in this together. COVID-19 is a thing, and we all have to try to get through it together as best we can in a civil manner. Ken, what are next steps?
Yeah, so where the subcommittee left it off at their last meeting is they had recommended the ordinance to the HHS board. They had recommended version 3 of the ordinance. So the next HHS board is scheduled for October 21st. So it would be placed on that agenda through our normal procedures. So if you want to talk about the previous decision that you had made to recommend that, whether you wanted to consider whether it should still go forward or whether you did want to pull the ordinance off the table now, that would be the choice of the subcommittee. So that'd be Greg, Kathy, and Dr. McGinnis. So you guys could schedule another meeting before the October 21st HHS board to talk about the previous decision that you had made.
Yep, I think that's what we should do, is take the input from tonight and regroup.
I agree.
I do have a question. A few people last night at the county soups meeting and at this meeting referenced all the comments on the survey. I went through all 500 and there's 544. I went through all of them as well. And I don't think it is 400 against. And I'm just wondering if Adam's going to be running analytics on those. Because I went through them personally and took the time and did not take that time as a health officer and put it on my time card. Not that that matters, but
We don't trust you.
So
I wanted to prepare for tonight, and I'm sorry I broke down. I feel bad about that.
Well, that's okay.
Yep. All right. So we've identified the next step then that you would like to take.
No, I want you to answer that question, Ken.
Adam has run some analytics. I would have to confer with him further.
Okay.
So I don't know what level of detail he's run those on.
Okay, but I think I'll reconnect with all of you to find a date that works before the next HHS meeting, and then we can regroup and discuss what happened tonight and path forward or whatever we want to decide to do. I thank you again for your time this evening and all your expertise. And unless there's any other comments, I move that we adjourn. Okay, Dr. McGinnis.
Just a quick comment. I also wanted to let people know that I indeed read through all of those comments on the survey as well and spent some time looking at it. And finally, people who do send comments into the county that they ask them to be relayed to me, they do all get to me, and I do read all of those as well. And those comments are appreciated.
Yep, and I should mention to people that are still listening that if they didn't have their comments said tonight, definitely submit emails, call supervisors, and submit comment. You can submit written comment to the county clerk to submit into the record as well. So there's ways to communicate with us still.
And if I could also, go ahead, Scott.
At our next meeting, Madam Chair,
Yeah.
if you want, I can present other alternatives if you're looking at other forms of ordinances or that relate to some of the comments.
I think that, that it may address some of the comments in terms of lack of checks and balances and some of the concerns. Yeah.
All right, I will do so.
Chair Leaf, I just wanted to thank all of the public that participated. We ended up with 126 participants online, a real rough estimate of about 150 that had come in person. We got through 46 people during the public comment and question period. So we got about 15% of those that had participated on. But I think that's a fairly good sample size for the county board and for your board to consider their input. And I just want to let them know that their input does make a difference.
It does.
I appreciate you coming out and sharing your thoughts with us tonight.
And I know that this is a very people have passion on both sides of this issue, and we understand that, and we understand our role as your elected officials and want to hear your voices. And I know it's hard, and sometimes you don't think we're hearing you, but we are. So, Elly.
You said you would
I just wanted
listen
to thank
to
everyone who did come out tonight, and I enjoyed being part of the panel, and hopefully some confusion related to numbers was clarified. And if it wasn't, I would like you to send an email in, or please reference on the dashboard itself. There is now a link straight to the FAQs surrounding the data. So if you do have questions, where are we getting this data from and how are we coming up with these numbers, and that are being posted on our dashboard, that FAQ is linked right there as part of the dashboard for you. Thank you.
Anyone else?
Madam Chair, could I just make a comment?
Absolutely.
I just want to say thank you to everyone that showed up tonight to make comments in the boardroom and online. But I also wanted to take just a moment to thank the public health staff who I have the privilege of working with on a daily basis, who work tirelessly and endlessly for the public's health. And I really appreciate it. I haven't worked with professionals of this caliber before, I don't think. That goes for all of HHS, but thank you all.
Anything else?
Oh, it'd just be an adjournment at this point.
Okay, I move to adjourn. Thank you, everybody.
Meeting adjourned at 7:36. Thank you.